Mandi, thank you so much for the time today.
Thanks.
I want to start out by asking you, what will your grandchildren look back in, say, 30 years? What are they going to look back at now and shake their heads about healthcare? You did that? What?
Yeah. I think that if we don't have to explain what a fax machine is to our grandchildren, I think if our grandchildren accept that fax machines exist, I think that we have done ourselves an incredible disservice, right? So I want to have to explain what a fax machine is, the way that now you have to explain the little save icon that is still a floppy disk, on all of the Word. Like I have to explain to my daughter that this is the way that you used to have to save things. This is this disk.
Or the phone that looks like a rotary dial phone
yes.
is still the icon for phone.
Exactly. So if I'm not having to explain what a fax machine is to my grandchildren, then we have failed. Epic fail.
All right, yeah, that makes sense to me. So your title, you use CEO, but you also use Chief Evangelist.
Yes.
Explain what you mean by that.
Yeah, so at Aloha Health, our mission is to allow healthcare to view patients as people. And so I consider myself an evangelist for the person-centric role in healthcare and for being able to create, redesign healthcare delivery and program management around individual people. And so I'm an evangelist for that concept, for truly putting the patient and caregivers and the community at the center of healthcare.
So I've heard you in other conversations talk about how a lot of companies give lip service to patient engagement and those type of terms.
Yeah.
What do you mean exactly?
Well, I think that we talk about engaging the patient, but there's a number of ways in which we only pay lip service. So first of all, from a technology standpoint, a lot of us are designing digital patient engagement strategies, right? But are we truly paying attention to whether or not those patients want to be digitally engaged and what percentage of patients want to be digitally engaged? And are we involving patients in the design process? So are patients actually being brought into the fold very early on and having a seat at the table as true collaborators and partners in the design and development, not just of the care delivery process, but of the technologies that we are essentially shoving down their throat, to enable our engagement. So there are things that make it easier for us to engage. There are things that make it easier for us to check on a box whether or not we have, quote unquote, engaged a patient. But, does engagement mean that the patient actually understands the information that we're giving them? Are they comfortable with the way in which we are trying to engage them? Are they going to be able to maintain the level of engagement that would be necessary for us to truly affect their outcome? And I think that we're not effectively addressing any of those concerns. And I think that we're continuing to give lip service to this idea of patient engagement and connected health without truly understanding what it means to engage more people in health management processes that could actually have a positive outcome for them. Like we need to understand why they would engage, how are they most comfortable engaging, what's their preferred methodology, and we need to design programs around that, around them, rather than around what's convenient for us and what new shiny object has come down the pike. Yeah, we love to chase shiny objects.
Yeah, we certainly do.
Yeah.
So talk to me about the steps you would actually follow in order to do that. I mean, is it a lot of focus groups and surveying and pilots and testing, or how exactly do you bring them into that process?
So I think it depends on who you are, right? There's a number, and Aloha is one of them, but we actually take a look at trust factors and attitudinal awareness around the use of digital engagements, how comfortable you are with receiving a recommendation for something like an app, whether you're comfortable receiving it from your provider and how likely are you to use it from your provider versus from your insurer, and that kind of thing, and looking at the trust factors and information exchange as part of the overall digital engagement strategy, whether it's actually digital or not, right? You can have an analog engagement strategy. So there's a data-driven approach that can be taken based on all of these kind of social and behavioral data points that exist in the universe. And you could also do focus groups. Like you could also, or put together a patient advisory board and pay them. So put together as part of your strategy, if you are in any way touching patients, and almost every single one of us here at HIMSS are touching patients in some way, whether they are directly our end users or whether they are indirectly responsible for the success or failure of our organization, have a patient advisory board and pay them. Like actually consider them as SMEs, subject matter experts, in their own care and in the ways in which they would like to be cared for and the ways in which they would like to engage, and have them participate materially in these design sessions. So bring them into a JAD, a joint application design session, like bring them in and have them participate and have, they may or may not understand all of the highly technical ramifications of things that are happening. They may or may not understand all of the very, healthcare geeky lingo that happens. We speak our own acronym language. But even the fact that you have to be able to explain what you're doing to patients, to people who are outside of our insular system and the way that we talk to each other, if you can't explain it to a patient when you're trying to design it, how can you effectively expect them to use it after the fact? And so I think that the earlier on we're able to recognize the value that patients bring to that relationship and include them in the process, the more we are going to be able to see outcomes improvement on the back end.
That makes sense. So what do you think healthcare does right, and what is their biggest failure for healthcare leaders out there? Give us both sides.
So I think that healthcare is an industry that is full of incredibly talented and passionate individuals who are desperately trying to improve health and welfare of the people that they serve, right? So I think at the individual level, our industry is teeming with really wonderfully compassionate, empathetic human beings who are desperately trying to make a difference and to make a real impact to make people healthier. I think that as an industry and as an industry, we are failing through the perverse incentive systems that we've aligned, right?
Yeah.
So from an industry perspective, all of the constructs that exist that drive our behaviors are not aligned to that goal, that very noble goal of improving the health of an individual human being or of a population. So things like the data hoarding that has happened, right? And the interoperability and the lack of interoperability, the fact that we're still talking about this 10 years later. Right? Like how are we still talking about this? It's fundamental and it's necessary. If you look at care coordination, how can you have care coordination without interoperability? And how can you expect a severely ill person to carry around? I saw a session yesterday where a woman who's a lung cancer survivor, and she's a stage 4 lung cancer survivor, and she carried around a tote bag that had to have weighed at least 40 pounds. That was full of all of her imaging records, all of her blood work, all of her pathology results, like everything, because there was no way. And as a cancer survivor, she's going to 3 different cancer centers, 4 different regional hospitals. She had 5 different doctors. There were a number of different pharmacies and labs that were participating in her care. And she became her own HIE. So she was an HIE of 1, and because right now we lack the interoperability, she's having to carry it around in a 40-pound tote bag. And this is a lung cancer patient. And so thankfully she was physically able to carry her records around, but a lot of people aren't. And how is it possible that we can expect the onus of the burden to be on a patient, especially if you are if you're ill? Why is it an expectation that even with all of this technology that we have, that you should be able to articulate every single test that you've ever had, every single dose of every medication that you're on, the results of every imaging study, that you should be able to understand, help a hospital A understand that you just were scanned 24 hours ago at hospital B, and here's the disc, and you can't explain why the software is different and why they shouldn't have to scan you again, but for you as a patient to have to be able to maintain all of that knowledge in your head and to be able to articulate why it matters, it's ludicrous. So
the technology really isn't that complex.
No.
Other industries have been doing it for a long time.
Yes.
It's just healthcare hasn't managed.
Yeah.
So what gives you hope about healthcare? How are we heading in the right direction?
The individual people, right? So the passion, I believe that the passion of the individual people will prevail. And I think that as long as there is hope for the resistance, right? Hope in the rebellion. I think that ultimately the individuals who are working so diligently to try to improve the health and well-being of their patients are going to find ways to make things happen even against the odds of the perverse incentives that are represented right now in our system. Yeah. I think that it's going to be a very slow change to adopt at scale because of those incentives, because of the misalignment. But I think that we are seeing right now a huge opportunity as a result of the changes that are coming down the pike from a regulatory standpoint of consumer awareness. So patients and people are now becoming aware of all of the ways in which they have been failed by healthcare in general, and they're starting to really understand all the ways in which healthcare policy and healthcare services play a huge role in their lives. And so we're seeing this kind of uprising of the people. So now that we have these really passionate individuals who are working in healthcare, and we're raising awareness of the importance of healthcare in homes and communities, I think that those two forces are going to be something to be reckoned with when it comes to redesigning system incentives in the future.
Yeah. Okay, so I'm going to dub you Queen Bishop. Queen Mandi Bishop, crown and all. You can do anything you want to healthcare. You control government the industry, and everything in between. Yeah, no, it's pretty
That's
cool,
amazing.
right? Yeah,
Yeah.
I don't know how long it's going to last,
Dude,
but
like, let's just do this now. Like,
for now, Queen Bishop, what do you do?
no
What's
screens.
your first edict?
My first edict is no screens. So my first edict is that the technology that we have even now could become seamless and could become seamlessly integrated into care delivery processes. So we should be able to have this type of a communication all of the time with our doctors, with our nurses, with our registration. Like, we should be able to have a face-to-face communication.
Yeah.
And all of the data capture around those conversations should be seamless and should happen, without me having to watch my doctor bury their face in a screen so that they can check every box in their EMR workflow. So that's the first thing. And then, of course, the data should flow, and it should be bidirectionally, not just sent, but ingested. So these care coordination for complex patients, it shouldn't even be a question that my primary care physician is aware when I have an admission into a hospital, and that all of the results of the imaging studies and everything that happened there are sent automatically back to my primary care physician, as well as, by the way, to the insurance company, so that they can go ahead and do the authorization. The onus of the patient to have to manage all of those processes while they're ill is ludicrous. So as Queen, for a day, the information is going to flow. The information is going to flow. It's going to be able to be ingested, and it's going to be actionable. So, the ADTs that are generated when I'm admitted into the hospital can have any number of ramifications downstream across both the provider ecosystem, as well as the payer ecosystem. And I, the patient, and the doctor can get back to having that truly human relationship that is necessary in order to facilitate trust and well-being.
Awesome.
That's it. No screens.
You don't vote for Queens, but I vote for you. That sounds great.
Mandi for Queen 2020.
So let's say that you're Queen for longer than a day. Let's
Yeah.
say it's a year, a couple of years.
Yeah.
What's it going to look like after year 3, after year 5? What's your kingdom going to be like? Paint the vision for us.
I think that if we can return the human element to healthcare, and if we can get back to the doctor-patient relationship, or even just the community-patient relationship, I think that the trust and we've lost a lot of trust in the healthcare system, and not necessarily in doctors as a result, but in some instances with some populations, there has been a significant erosion of trust in clinicians and healthcare practitioners.
Yeah.
And I think that we would have the opportunity to help a much broader spectrum of people who right now feel very marginalized and feel betrayed by all of these processes. And those include the people who are incredibly ill, who aren't able to effectively navigate the system. Mm-hmm. So that's it. I think that if we're able to return the humanity to healthcare, I think that we could truly transform the health and empower people to be able to manage their health, because they might feel like their opinion has been valued. They might feel like they have been heard as an individual, and that just the mental aspects of being able to feel like you have been heard and respected is transformative for your own health.
Yeah. Okay.
So, yeah.
So talk to us about advice you would give to women in healthIT.
Yeah. First, get into healthIT. I mean, I think that we have a challenge here, kind of more broadly as a nation, about women in STEM fields in general, right? And they say that if you don't get girls by fourth grade, it's about fourth grade when girls in the United States start losing interest in science and math. And a lot of it is cultural here. So girls, like if you look at the television, commercials for girls, they're very highly segregated. You've got a lot of dolls. You've got a lot of dolls, and then everything is painted pink, and so we artificially gender segregate, very, very early on. And even something as simple, like I noticed my niece is about to turn 2, and when she was born, I was trying to get her a cute little outfit, and I realized, okay, we put ruffles and ruffles on the panties that are associated with little girls' things. We kind of sexualize and objectify girls from birth. Yeah. So we do this from birth, and that type of attitude carries forward through their entire developmental life, and it can become a dissuasion from entering into intellectual fields like science and math. And so if we start very young and we stop this artificial segregation of gender preference and the types of toys that they should play with and the things that they should do, I think that we could develop a much stronger opportunity to encourage women to enter health IT, right? To enter healthcare and health IT. I also think that once you're in college or once you're looking at this, if you didn't start out thinking that you were going to go into technology as a woman, like it's not, or as a man, but it's not too late. So I have a master's in rhetoric and composition. So I did not go to school for the analytics career that I have had. I didn't go to school for healthcare. I had not been in a healthcare related field, but I fell in love with it. And I became very passionate about it. And so I think as a woman or as anybody, being able to recognize that you can teach yourself and that you can change and that it is acceptable to have a reinvention of yourself, at any given point in time, and knowing and having the trust in yourself that you can make that happen is important. But I also think that you have to find male sponsors who are, it's very important that you are able to find male sponsors who are able to help you navigate the space that you're in, navigate the organization where you're working, because everywhere is different and some places are much more progressive than others, but there are always going to be individual champions who can help you further your career and who can serve as mentors. So having male and female mentors and champions is really important.
Okay.
Sorry, that was a big, broad answer.
No, I liked it. That was great.